Sickle cell disease is an inherited illness of the blood cells. It's primarily found in African Americans in the United States. It's a result of having a genetic trait inherited from both parents. And what happens is the red cells, whose purpose is to carry oxygen throughout the bloodstream, instead of being shaped kind of roundish, become shaped like a sickle or a banana, so that blood has trouble getting from place to place. And that can cause lack of oxygen and both acute or sudden problems like pain or chronic problems like organ damage. The only way to get sickle cell disease is inherited. It's a gene that's been around for many, many years, tens of thousands of years. The most common type of sickle cell disease, which probably affects 3/4 of the patients affected, is called hemoglobin SS, or homozygous SS disease. And that happens when both parents have the hemoglobin S or sickle cell trait, and the child inherits that from both parents. There are other types of sickle cell disease as well, some which are a little more moderate in terms of their severity. For example, there's something called hemoglobin SC, which is also fairly common. And what happens in that is you get hemoglobin S from one parent and another trait, such as hemoglobin C in this case, from the other parent, and that results in a type of sickle cell disease as well. There are other types of sickle cell disease that we also encounter, such as hemoglobin S thalassemia, where you inherit sickle cell trait from one parent, and a gene which is called a thalassemia gene from another parent, where you don't make as much normal red cells as you normally would on that gene. So that is also a type of sickle cell disease. Sickle cell trait is when you carry the trait for the disease. It is not a disease, but it's not completely benign either. When I meet a patient with sickle cell trait, I do tell them that under extreme conditions, they need to use what we call universal precautions, good hydration, appropriate clothing for the environment. And this is no different than any other child or adult who's involved in an intensive sport or intensive activity of some kind. There was some controversy regarding sickle cell trait in college sports a few years ago, but that was not really based on any scientific basis. But we tell these kids that sickle cell trait is not a problem for them, but they need to understand under extreme conditions it can act as sickle cell disease if you're very dehydrated. The other thing which is extremely important about sickle cell trait and all these other traits we've mentioned is genetically, it's part of your history. So when you're at the age where you're able to have children at that part of your life, it's important to be aware of your own genetic history, because that's going to, the more knowledge you have about yourself, the more power you have, and the better it is to make appropriate decisions. We are now in a place where the treatment of sickle cell disease is really to prevent problems. And what happens is kids are now identified via newborn screening. So we identify the children and diagnose the children typically within the first few months of life. So it's very unusual not to know this by 30 to 60 days of age, 1 or 2 months of age. And we now use a medication called hydroxyurea for the more severe patients.
Now that we're using it earlier and more widely, it's really changing the landscape for how people grow up and develop compared to just a few decades ago when I was in med school.
It's actually a very exciting time for sickle cell disease right now in regards to research and emerging treatments. The only cure available right now for sickle cell disease is bone marrow transplant, which we use, in certain specific situations, but it's not without its own set of risks. On the horizon, we're looking at a series of new medications, both to treat sickle cell disease in a chronic fashion, as well as to help manage the crisis, which may be available in the next few years. And we're also looking at, gene therapy.
And there are clinical trials right now where we're taking a patient's own blood cells, their stem cells from their blood or from their bone marrow, editing the genes in a dish to specifically eliminate the complications of having sickle cell anemia. And then we put the patient's own cells edited cells back into their body. And this is a potential cure for sickle cell anemia. This is a way of taking someone with sickle cell anemia and making them into someone who doesn't have sickle cell anemia. This is very exciting. Clearly needs a lot of testing, clinical trials to prove that it's first safe and second effective. But the preliminary data look very promising, and this is potentially very exciting. I would love to be sitting here a few years from now and tell you that we've put ourselves out of a job by curing sickle cell anemia.